If you are new to my channel and want to educate yourself more about herpes viruses, please like my videos and subscribe to my channel. Make sure to ring on the notification bell so that you'll be the first to watch my uploaded videos every day. Let's put an end to the herpes virus.
HSV-1 in babies. Nearly all HSV infections in newborns are HSV-2 and transmitted when the baby passes through the birth canal. The risks of transmitting HSV to a newborn are the highest when a woman is experiencing primary herpes during the third trimester. After a woman has experienced primary herpes and rather has recurrent herpes while pregnant, the risk of transmission to the baby is only about 3%. Additionally, pregnant women who are infected with HSV that is not active but was acquired during the pregnancy are also at a high risk of transmitting it to the baby. Whenever there are vaginal lesions either being primary or recurrent. However, the risk of transmission is most heightened for a vaginal delivery. The problem with HSV infections in infants is that in most cases, it occurs when the mother does not know she has HSV and is not symptomatic. This is because in most cases where it is known, the proper preventative steps are taken to prevent transmission. Newborns and infants can also contract HSV-1 as a result of being in close contact with someone who is infected by either coming into contact with their saliva or through direct skin-to-skin contact with a person who is experiencing an outbreak. HSV-1 is far less severe than HSV-2 in newborns and usually only results in cold sores or blisters around the mouth and/or lips. When a newborn contracts HSV within the first month of life, it is known as neonatal herpes or congenital herpes. This infection can be very serious, primarily when the baby contracts HSV-2 and it is systemic, meaning that it affects the entire body. In most cases, when newborns exhibit symptoms, it is almost always followed by an infection. The severity of the infection is significantly heightened in newborns because their immune system is not fully developed, and as a result, the virus can enter the brain and spinal fluid much easier, and when it does, it can result in serious complications. Newborns that are infected at first may exhibit only mild symptoms, such as a low-grade fever, poor feeding, or a few small skin blisters. These symptoms can occur anywhere from 2 to 12 days after transmission of the virus. For some infants, these symptoms will remain mild, but for others with a systemic infection, things can escalate very quickly. In these more severe cases, the fever may become high, the baby may experience seizures, lethargy may kick in where the baby becomes floppy, and eye inflammation, blindness, and respiratory illnesses could occur. The baby's vital organs can also be affected, such as the lungs, kidneys, liver and central nervous system. When the liver becomes affected, the baby will likely become jaundiced, while when the central nervous system is affected, seizures, shock, and hypothermia could occur. In the most severe cases, HSV-2 can cause encephalitis, which causes the brain to become inflamed and often results in brain damage. If you think your baby is experiencing any of these symptoms, mild or severe, it is very important to contact a physician immediately to have your baby examined. Treatment for babies with HSV. Unfortunately, neither HSV-1 nor HSV-2 can be cured. Rather, they can only be treated and managed. In both children and adults, HSV-1 generally does not need to be treated by a physician. In most cases, a cream containing anti-HSV medication will be sufficient to treat the cold sores. Additionally, for babies, anesthetic mouthwashes and/or pain medication may be applied to reduce pain. Intravenous fluids will also likely be given to prevent dehydration due to difficulty drinking as a result of mouth sores. In contrast, HSV-2 infections require immediate medical attention and treatment for infected infants. An infant that is infected with HSV-2 requires hospitalization for 21 days where intravenous antiviral medication is administered. For infants, the only liquid antiviral medication that is currently approved and used is acyclovir, Zovirax registered trademark. In many cases, this antiviral treatment will be sufficient to take control of the situation, but in some cases, even with the treatment brain damage and/or death could occur as a result of the infection. How can HSV be prevented in infants? If you know you have HSV-2 and are experiencing an outbreak or think you may show symptoms of it, it is very important to let your physician know as soon as possible. In most cases, a C-section will be recommended for mothers with HSV-2 who are experiencing an outbreak at or around the time of delivery. In doing so, transmission can usually be prevented by preventing the child from coming into contact with the virus. If you are not pregnant but wish to become pregnant and either you or your partner has HSV, it is also important to consult with your physician prior to becoming pregnant to examine the risk and preventative measures that might be taken. Even if you or your partner has no history of HSV, it is not a bad idea to get tested prior to becoming pregnant as well. Additionally, ensure that anyone who touches or holds your baby washes their hands prior to doing so and do not let others or yourself kiss your baby if they have cold sores in and around the mouth and/or lips.
Thank you for watching. And please subscribe to my channel for my upcoming herpes treatment videos.